Hi, good morning. This is Jovy Gutierrez, AXA Certified Health Specialist and Unit Head. I would like to discuss with you one of our newly launched product, Healthcare Access. I will just give you an overview kasi nga, di ba, yung normal na HMO dito sa Pilipinas is up to 200,000 benefit limit. Now, with our healthcare access, we have different variants. We have 500,000, we have 1 million, 2 million, 4 million, and 5 million. And good thing, this is renewable until age 76, until age 75, sorry. But then, at the age of 76, client will have a longevity fund. So let's say if client will have 5 million annual benefit limit, so and he keeps on renewing until age 75, then by the age of 76, policy will be terminated, but client can have 2.5 longevity or retirement fund. Okay ba yon? So let me share my screen to discuss some other benefits. Okay. So, di ba, as family or as a breadwinner, ang gusto lang natin lagi is to have a happy, healthy family. And syempre, but then, there are uncertainties in life. So, nagkakaroon din ng mga health issues and also tumataas din ang medical expenses. So, let's say magkano ba ang cost ng heart attack? So, 636,000 kapag na-hospital si client, or even ang average cost of having a COVID, which is very common right now, is 1,100,000 pesos. Now, even if yung ating PhilHealth would not be enough to cover all these expenses, and if wala tayong health insurance or health coverage, we end up borrowing money to our family or friends, or yun nga, nagagalaw natin yung ipon natin, which we can avoid those kind of things if we are prepared, or if we have something na backup para sa health insurance natin. Now, of course, deduction on PhilHealth is not enough, and also mahal ang magkasakit right now. So what we have with AXA is that we have now this healthcare access, and then we also have global health access, and also Health Max and Health Start for critical illness. But then that one, I already had different videos regarding Health Max and Health Start. I don't have yet for GHA. And now this is about healthcare access. So ano ba yung difference ni healthcare access kay global health access? So this one, healthcare access is for Philippines only, with annual benefit limit of 500,000 to 5 million, renewable until age 75, and access to 1,400 hospitals and clinics in the Philippines. And then if you will get a family coverage, there will be a 10% discount. And also, there is a 30-day waiting period for illnesses, so except for accidents, dengue, fever, and rabies claims. And other benefits, inpatient and outpatient, and emergency, dental care, and annual physical exam, and longevity health fund. And then optional riders is optical care, critical illness booster, and annual benefit limit booster. So what does global access health access does? So this one is access with annual benefit limit from 50 million to 175 million, renewable until age 99, and access to 1,400 hospitals. So same thing. And then family coverage is 15% discount and no waiting period for non-dread illnesses. It has inpatient and day treatment, outpatient and emergency treatments, dental, optical, and health screening, maternity care, alternative care, palliative, and hospice care. And then with added value benefits, global concierge, international emergency medical assistance, built-in second medical opinion. So now this is the new look of our AXA Healthcare Access. This is very affordable and flexible, and it will give you a comprehensive health protection. So there is also an access with 24/7 teleconsultation. So there are two types of healthcare. One is Healthcare Access Prime, and the other one is Healthcare Access Lite. So the difference in here, walang annual physical exam kay Healthcare Access Lite, and also wala din siyang dental care and outpatient care. Now, ang difference nito is that Healthcare Access Lite has you can apply for deductibles like 100,000, 150, 200, depende sa gusto mo. Now, and also this one is good for people who have existing HMO tapos gusto lang nila ng additional coverage. So this is the 5 variants: Plan 500, 1 million, 2 million, 4 million, and 5 million. So it has inpatient. This is the prime, inpatient care treatment, emergency care treatment. Life and accident insurance coverage is 10% of your annual benefit limit. Longevity fund is until age 76, so will be 50% of what you are of your limit that you have. And then annual physical exams, dental care is covered, and outpatient care treatment will depend on your annual benefit limit. So let's say you have 1 million benefit limit, so your outpatient care is 50,000. Ang kagandahan dito kay healthcare access is that you can opt for critical illness booster. So it will depend also kung ano yung plan na nakuha mo, yun yung magiging limit. So let's say you took 1 million annual benefit limit, so si critical illness booster then will be 1 million. And then optical care is optional. So with Light, Healthcare Access Lite, so ito yung sinasabi kong deductible, 100, 150, or 200,000, and annual physical exam is not applicable, while dental care and outpatient care treatment is optional and the rest is optional na. So the inpatient care coverage, I can discuss this during our one-on-one meeting if you are interested to have one. And then with healthcare access, there will be 1 year waiting period for serious illnesses. So cancer, hepatitis B, hepatitis C, diabetes, heart disease, kidney failure, high blood pressure, chronic obstructive pulmonary disease, liver cirrhosis, stroke, cerebrovascular accident, transient ischemic attack. But if you have critical illness booster on your plan, then ang waiting period lang nun is 60 days, and there is a 30 days of survival period. So with healthcare access, of course, mauunang ma-deduct si PhilHealth. So kung wala kang PhilHealth, client will shoulder out-of-pocket expenses na yun. Unlike kay Global Health Access or GHA, PhilHealth is not required kasi binabayaran ni AXA yung total hospital bill ni client. Now, this is powered by Avega with 1,434 hospitals and clinics, 56,962 affiliated doctors and specialists with 15 regional satellite offices and 1,324 optical and dental networks. So let me continue. Of course, this is critical illness booster. So get additional cash benefit equivalent to 100% of your annual benefit limit upon diagnosis of any of the 56 covered critical illness, which includes cancer, stroke, or heart attack. Kasi yun yung top 3 eh. Avail of this benefit by adding a small additional premium. While annual benefit booster, syempre ito yung you can keep up with the rising medical cost with a rider that automatically increases your annual benefit limit by 10% every 3 years. So ito naman, it has a small additional premium, but then if client doesn't want to have this, we can remove naman. But then hindi na yan pwedeng ibalik. So ito yung 56 major critical illnesses coverage, but then this one we can discuss later. So kapag na-diagnose halimbawa si client ng critical illness, let's say ng cancer, so there will be like 60 days na waiting period. Tapos 30 days na survival period. So dapat upon diagnosis, so halimbawa yung plan niya 3 months na, so tapos niya na yung 60 days na waiting period. Now, so halimbawa na-diagnose siya ng let's say December 1, then a client has to survive until December 30. Then from December 31, pwede na mag-file ng claim. But kapag nakabayaran na yung claim ni client, then ita-terminate na yung ano niya, yung critical illness booster, but the policy will still be in force. So as I've said, if let's say you have a family, you want to avail the family plan, of course, ano siya, meron siyang 10% na what you call this, 10% discount. So this is the one that I'm talking about. If let's say you will get health access prime for male 30 years old, if 500,000 yung coverage, 26,179 lang yung babayaran ni client. Now, pero syempre hindi pa kasama dito si critical illness booster, so plus 600 pesos. Imagine, ang liit lang ng premium for critical illness booster. Then, kung halimbawa naman, meron siyang existing HMO at gusto niyang magkaroon ng deductibles, let's say 100,000 para hindi ganun kalaki yung babayaran niya per month. So, the premium will be for 500,000, 13,338.50. Now, kung 1 million naman, 17,440.95. Not bad pa rin kasi nga, malaki pa rin yung naging, kumbaga, yung difference. And also yung coverage niya malaki pero maliit lang yung premium na binabayaran. So optical care is there until age 75 also. So yan, for female naman na 30 years old, if let's say 500,000, 29,606. And then if let's say may deductible siya, let's say na 200,000, so ito na lang babayaran niya, 12,081.66. So the same thing, so I can do a free proposal naman for you to have a look, and then we can discuss the details of the plan if you are interested to have healthcare access. And Let me just check what I can still share. But then this is just like an overview of the plan of healthcare access kasi nga marami nagtatanong, so at least you will have an idea how does it work. But of course, meron din namang mga auto-decline na illnesses. So there you go. That's the overview of healthcare access plan. Now, if you have questions or if you wanted to have a free proposal or also a sample quotation for your family, you can just message me or you can reach me at 0917-8989-070. Thank you and have a nice day.